how do you deal with emerging infectious diseases that have very high morbidity rates? If it's not Ebola, it could be ZIKA, it could be the opioid epidemic. So we learn a lot from it. We hope that we help the country we're visiting, but it's just a very good program for everybody involved.
The need was urgent, the warnings dire. With the outbreak of ZIKA, there could be up to 60,000 cases in Costa Rica. Students from UMB, led by the faculty from the University of Maryland's Center for Health and Homeland Security, went into the jungles of Costa Rica to find out firsthand how that country managed to contain a major health threat. The trip was made possible by the generosity of donors like you.
Phenomenal trip to meet with country leaders and understand both what their systems are to address an emergency like that, and also what some of their prevention was.
So the goal was, they were expecting maybe 60,000 cases of ZIKA and Zika congenital syndrome in their country based on estimates from Brazil and Colombia. And it only ended up affecting about 1,700. And so our goal was figuring out what steps did they take to make them so successful in that endeavor.
Public Health Program Director Trudy Henson was one of the mission's leaders.
It was great for both us as professors and also for students. We got perspectives I don't think we would have gotten elsewhere.
She's got a world of experience, but still she picked up a lot of interesting thoughts and ideas from the interchange, and so it's a win-win situation.
Professor Henson, along with Academic Program Director Mike Vesley, traveled to Costa Rica with students from UMB's schools of medicine, pharmacy, nursing, and public health, thanks to the generosity and support of the Center for Global Education.
The project went very well by all accounts, from our Costa Rican partners, from the students who participated, from the CHSS faculty who participated. They were able to look at the Zika epidemic from the public health perspective, from the science perspective, from the legal perspective, and they came back with a really rich understanding of a robust response to a dangerous epidemic.
Tremendously, absolutely. The interchange between those nursing homes and our experienced faculty, we have an enormous amount of writing, research we want to do on counterterrorism, emerging infectious diseases, dealing with superstorms like Florence, which is one we're dealing with right now, cybersecurity. There's a lot of work we could be doing if we had the funding to do it. And that's what we're hoping will happen.
Just weeks after the Costa Rica trip, our own Mid-Atlantic region scrambled to make preparations for the possibility of a devastating hurricane, one that could bring catastrophic flooding, high winds, and power outages that could last for weeks. Imagine the plight of the most vulnerable residents, some in wheelchairs, others in hospice care. Thanks to your donations, nursing home administrators from around Maryland now have the tools and training to plan for emergency situations like hurricanes. At a gathering at the Shady Grove campus, Continuity Program Director Eric Odo led a discussion of the many things that might go wrong in the event of an emergency requiring evacuation.
You may not have the necessary transportation logistical support to transport the people from point A to point B. You may not have adequate facility space at an alternate location to house them. You may not have enough personnel on hand to physically, if you have seniors or people who require additional medical care or certain sensitivities, you may not necessarily have enough staff on hand to carry that out.
We felt that we were very prepared, but after taking this class, I feel that we could become even more prepared.
I mean, if we have to evacuate residents, that would be a challenge. Getting transportation, staffing, and all of that was covered today.
Long-term care administrators say the exercise at Shady Grove could be crucial to the survival of their residents.